They felt fine, they had no pain, no symptoms, and everything was going on well. But the cancer was already growing. Cancer does not always shout. Sometimes it whispers or says nothing at all until it is too late. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Nderitu, a family physician. In this video, we are going to look at how to detect cancer early, even before you feel sick. How you can be able to tell the symptoms of cancer and how you can take action so that you prevent yourself from getting diagnosed at an advanced stage and avoid the misery of cancer that can overwhelm you. So, why is early detection important and how does it save lives? 1 in 6 deaths globally are due to cancer. Early stage cancer can has up to 90% survival rate. So if you can be able to detect cancer before the symptoms spread and before the cancer moves out of its primary organ, you have a chance of 90% survival rate for 5 years. Then late stage detection is often too late and it is accompanied with more morbidity and associated with more mortality. So the earlier you find out, the better and the better your chance of beating the cancer. So how do you know that this could be cancer? These changes in your body could be signs that it could be cancer. One, you have a persistent cough that is not going away, and the cough is there during the night, and it is also accompanied with weight loss. You have changes in bowel or bladder habits. Either you have constipation or hard stools, or you have loose stools that are persistently there, and these symptoms persist for long, or you have inability to go for long call that is taking too many days before you open your bowels. Think, could this be cancer? Or you have changes in your blood habits. Possibly you take long before you go for a short call, and when you go for a short call, you have difficulties passing urine, or the presence of blood in your urine could be a danger sign. Then you have unexplained weight loss. This could be due to various factors which are associated with cancer, high metabolism, inability to eat, and the other factors. Then you have lasting fatigue, generalized body tiredness, which is not going away, despite taking the necessary measures that you think could help you alleviate this persistent fatigue. Then, if these symptoms last for more than 2 weeks, go and get checked. This is not just a code, it could be a clue that something is happening in your body that is not right. Then there is the presence of lumps, bumps, or unusual swelling. So these swellings could be in your breast, they could be in your neck, they could be in the armpit, or they could be in the groin. So when you find these lumps in the areas that I've talked about, this could be a sign that could be an indicator that something is happening, or this could be lymph nodes that are swollen in your neck, in your armpit, or in your groin. You need to go and get checked. The unfortunate thing is that most of the times these bumps or lumps are not painful. So sometimes the motivation to go for a checkup is not there. And this can be deceiving and you think everything is going on well. So the bumps are persistent and they are painless, and then they continuously grow and they are firm and do not move. So if there is no pain, it doesn't mean there is no danger. And this is one of the things that I get from most of my patients, that I've had this lump, it is not painful, so I've just left it on its own. So this is could be a danger sign. Go get checked. Then the third clue is unexplained bleeding or discharge. The bleeding could be in your stool, it could be in your urine, it could be in your saliva or coughing blood, or it could be vomiting blood. You can also have unusual vaginal bleeding or presence of blood in your rectal area or when you are passing blood in urine. Then there could be also be discharge or fall odor from any of your body openings. This could be a danger sign that something abnormal is happening and your body is sending a red flag. So don't ignore this. Go and get checked. Then the clue number 4 is skin or mouth changes. You notice some sores that do not heal in your mouth or on your skin. You also have moles that change shape or color or size, and they are uneven. Sometimes they can be painful. Then you may have red or white patches in your mouth that are progressively growing, and they might be painless. So when you have this, cancer shows up sometimes in plain sight. If you know where to look for, you might be able to detect it early and you get treatment on time. There are some screening tests that can help you also detect cancer early in time. A test like Pap smear, it is able to detect cervical cancer 10 years before the cancer starts. And if you have abnormal cell changes, then you can be able to get treatment, and early intervention will help you to detect the cancer early. Then you have mammograms. Mammograms, these are images of your breast that help detect uh, early lumps before you can even feel them with your hands. And they help you detect cancer or abnormal growth in your breast that can be further investigated with what we call a biopsy, and cancer can be diagnosed before it moves out of the breast. Remember, I said that cancer detected before it moves out of its primary organ then has a survival rate of about 90%. Then for prostate cancer, we have what we call prostate specific antigen. This is a test that can be able to detect early prostate cancer. I know that the results sometimes can be controversial, but if there is a risk and your health provider suggests that you need to do a PSA, then it is important that you do it. And when you have anything abnormal, then you need to go and consult with your health provider. A colonoscopy. This is an investigation where a tube, what we call a flexible tube, is put through your anal opening into your large intestines and looks through all through your large intestines, and it can be able to detect any unusual growth. And remember that before colon or rectal cancer starts, it starts with the polyps, and many times these polyps are benign. Benign means they are not cancerous, and when they are detected early, they can be removed and your risk of cancer detected. So are you beyond the age of 45? Do you have a family history of colon cancer? Then get a colonoscopy, and this will give you a 10-year assurance before you do another one. So you see, this is not a test that you keep doing. Once you do it every 10 years, it gives you a 10 years assurance that you are okay. If you are a smoker and you think you could be at risk of getting lung cancer, then do a low dose CT scan to detect unusual lumps in your lungs before they develop into a cancer. Then there's the oral screening, where you have oral exam for examination of unusual lesions in your mouth and unusual growth, and this helps you to detect mouth and throat cancers before they have grown beyond the oral cavity into the lymph nodes, and they beyond the normal expectation. So screen early, then also screen regularly, and especially if there is a family history of cancer in your family, you need to take this seriously. So who are the people who should be concerned about cancer? If you're above the age of 40, if you have a family history of cancer, anybody in your family with cancer, then you need to take precautions. If you have excess body weight, either you are overweight or you are obese, you need to be more cautious and start working on weight. If you're a smoker or you are taking alcohol excessively, then you need to be concerned. If you have people who have chronic inflammatory conditions or any of the chronic inflammatory conditions like HIV, then you need to take more precautions. Or if you have infection with hepatitis B or human papilloma virus. Early action is better than later regret. And the more cautious you are, you will be more safer and you will put yourself not at risk and be able to control the cancer before the cancer controls you. So you don't have to wait for symptoms. Cancer can be caught early, and if you look for it aggressively. So listen to your body, know what is your risk, get screened, and encourage someone to go for screening. If you like this information, remember to like, share, and also uh, comment on the comment section of this video so that we can save a life. Remember to follow the overall health YouTube channel for more tips on life-saving health content, and also remember to subscribe. Thank you for watching. We meet in our next video.